Working out throughout the week, of course, is a goal for so many of us, but man, is it challenging. Well, a new study has some good news. You may get the same heart health benefits from working out just on the weekends, just 2 days. And we are talking the same reduction in risk of heart attack, heart failure, and stroke. Adults are advised to get 2.5 hours of brisk physical activity each week. Many try to do a little bit each day. Harvard researchers finding that weekend-only workouts can reduce your risk for heart disease and stroke almost as much as daily exercise. That's the headline. And here to break it down with us is Dr. Shaan Khurshid, behind this study, an instructor as well of medicine at Harvard Medical School. Doctor, this is music to my ears. Thanks so much for being here.
Pleasure to be here. Thanks.
Bottom line, are you saying that based on this study, I do not have to work out during the week? I have permission to only work out on weekends?
In terms of bottom line, that's true, but you're going to have to exercise more on that 1 to 2 days a week where you concentrate your activity.
So how much? The key is. Sorry, I don't want to interrupt you. I'm sorry. How much exercise exactly are you saying? I'm taking notes. How much exercise exactly on a Saturday and a Sunday are we talking, and what kind?
Yeah, so current guidelines recommend getting at least 150 minutes of moderate to vigorous physical activity per week. In our study, we compared whether you get that physical activity level, that 150 minutes, spread throughout the week versus concentrated, where the majority of that is in 1 to 2 days of the week. And that latter group we called the weekend warriors. And as you mentioned, we saw very similar reductions in cardiovascular events, heart attack, heart failure, stroke, and atrial fibrillation, which is a common heart arrhythmia.
Were you surprised when you saw these results?
We had the privilege of being able to study 90,000 people who wore wrist-based sensors, where we really were able to quantify their activity over the course of a week. And so we can actually have a lot of ability to detect even small differences. And so I was a little bit surprised to see really no difference in the amount of benefit we saw across the two active groups.
And I know we're primarily talking about heart health and these sort of preventing these major heart events. Any indication yet on other areas that we should be looking at, whether it's insulin resistance or brain health, these other sort of markers, or is that sort of the next body of research that you'll be going into?
It's a great point, because we know that physical activity is good for conditions across the spectrum of human disease. One issue that comes up a lot is risk of injuries. And so we did specifically look at musculoskeletal injuries, and we saw, again, similar reductions, lower risk of injuries with both active people who distributed their activity evenly and weekend warriors. They both had a lower risk. In terms of other conditions, like you said, mental health issues, respiratory conditions, that is something we're actively researching. The preliminary data suggests, consistent with cardiovascular disease, there appear to be very similar benefits.
It's really interesting. And you know, Dr. Shaan Khurshid, we certainly appreciate your time. I think bottom line, either way, you actually have to do it. I mean, the mistake would be to put it off 5 days and then be like, I'm not going to do it on Saturday or Sunday either. But I know a lot of people are taking a look at this research, and there will be more research to come from you. Thank you.
Thank you very much.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.